Welcome to Get Well Network's webinar. You could change the slide for me. Today we are going to be presenting on the new normal of hybrid care, how Cerner organizations win with digital health. Change the slide again. As Tanya mentioned, my name is Whitney Akers. I serve as a senior director on the Get Well Network strategy team, and I am joined by two additional speakers this morning. So our Vice President of Strategy, Candace Chan, is with me. And then we will also have the pleasure of hearing from Tressa Springman, who is the Senior Vice President and Chief Information Officer over Enterprise IT and Process Improvement at LifeBridge Health. Slide. Between the three of us, we have an exciting three-part agenda today. So first, we're going to do just a little bit of reflection, and we're going to look back at the practical tactics from our client community that were used to really quickly operationalize technology, as well as centralized delivery teams to manage COVID-19 outbreaks at scale. And Tressa is here as a great example of that. She's going to walk you through the LifeBridge Health pandemic response process and story, which we chose because we believe so much of the work that they did there and the approach that they took will directly translate to future success in other areas and really serve as a great example. So I'm excited for you all to hear from her. Second, we're going to pull back and talk you through what we learned. So for this portion, Candace is going to share the top 5 observations that we took away and the strategic implications that come with them that every organization should be thinking about moving forward. And finally, based on those observations and implications, we have at Get Well Network really refined our product vision, and we are very excited to share with you what our look forward strategy is to support you all as you navigate this new landscape. So if you could go to the next slide. Before I dive in and introduce Tressa, I really want to pause to say thank you. These are extraordinarily difficult times. The work that you all are doing to help the community to stay safe, is so appreciated. And like all of our hospital partners, we've spent the last 6 months in rapid response mode, and we are honored to have the opportunity to work alongside some of you folks. As you can see, some of our partners on the left are listed here. Our team supported over 200 hospitals and 170,000 patients since March in navigating this, and the response was truly amazing, as you can see with some of the numbers on the slide. We're really honored to have been a part of the effort, and we thank you for all of your hard work. To provide a little bit of context, again, just to ensure that the Tressa story comes through strong, folks are kind of following with us. Our partnership with organizations as it relates to COVID-19 response really fell into 2 primary buckets. So first, on the left, we partnered with organizations including LifeBridge through our GetWell Loop platform to remotely monitor and manage COVID-19 populations. So patients would complete daily automated check-ins from home that included a combination of education and symptom checks, and care teams were then sent real-time alerts to any escalating symptoms, which allowed them to manage these patients at scale and respond as needed. In addition to that platform, which we'll hear more about, we also partnered with organizations on the inpatient side as they really kind of scrambled to reorganize serving patients in the inpatient care setting during the height of COVID. Organizations used our GetWell inpatient engagement platform deployed on smart TVs at the bedside to communicate important information with patients around new guidelines, infection prevention in the inpatient setting. Across all of that work, and if you could change the slide, we really had a front row seat, and we learned a lot. One client in particular stands out that we want to profile today, LifeBridge Health. And before I turn it over to Tressa to share their story, I did just want to spend a second on the left-hand side of the screen calling out why we actually chose this story to tell. So in the early days of the pandemic, health systems were essentially, as this group knows well, forced to deploy any and all forms of digital health technology overnight, quickly as possible. And one of the challenges that we saw organizations struggle with as a result was a really fragmented digital journey, a kind of piecemeal solution to virtual care, which is something we're still seeing quite a bit of today. And we felt like LifeBridge did a really great job overcoming that. They used a very thoughtful combination of people, processes, and technology integrations within Cerner to create a truly seamless virtual patient transition process that guided patients across the 5 areas that you see here at the top. So from triage to testing to treatment, whether it was remote or in person or in follow-up, the patient was really guided seamlessly. The second thing we loved about the story, and part of the reason that that seamless transition was even possible, is because they were also able to quickly centralize their care management resources to manage patients in a really coordinated way across the system. And finally, they also ensured that they were getting paid for these digital care efforts. So with all of the legislation changes, a lot of folks kind of threw up their hands on that. They really dug in, understood the new guidelines, and made a lot of effort to make sure that they were getting credit for that new virtual care that was being provided. Now, later in the presentation, Candace is going to talk about the future implications of having built a model with these characteristics. But before we jump there, let me introduce Tressa so she can walk you through their story and introduce their organization. Tressa, take it away.
Great, thank you, and good morning, everyone. Fantastic to be here. Whitney, you made it sound so organized, but as I'm sure many of the participants have experienced this strange pandemic that's been upon all of us, and really organized is not how any of it has felt, but thank you for the compliment. And as you can see on this slide, a little bit of information about LifeBridge Health. I'm not going to go through the statistics. We probably are most mature on the utilization of GetWell Loop. We do have inpatient and have for many years at one of our inpatient organizations, and are completing the deployment across the enterprise this year, and then of course Rounds Plus. So would love to talk a little bit about what our journey was and each of these steps. Next slide. Great, thank you. So before I hop into this, I just want to share that a colleague and I put a small poll out to a group of peer CIOs in early June. And we asked them, what were the top 3 lessons that have really surfaced from this pandemic? What are 3 things that came to the surface that you believe helped your organization be successful? And what's really beautiful about this, honestly, is the story I'm going to share with regard to our partnership with GetWell has been that they really knocked it out of the park on all 3 measures, and all 3 measures of success. The first of which was flexibility. You need a platform that's flexible. Secondarily, you need something that enhances communication. And this couldn't be more representative. And then finally, one of the lessons is you had to have had some infrastructure. So I think it's important that you know that we, like you, had already an EMR in place. We had a relationship with GetWell, and it was really effectively leveraging it. So let me talk a little bit more about that. And we'll start with our triage process. As you can see here, very early on, our providers, the state themselves, Baltimore City, phone operations, people were inundating us with questions and direction and, frankly, fear as people started self-identifying that they thought they might be symptomatic. And since March, we stood up a centralized screening hotline. It was a phone line, and it was staffed by and large by furloughed clinicians coming out of our ambulatory practices who early on had been closed down. Since that time, we fielded over 27,000 screening conversations. And as many of you know, that had to be really dynamic because the guidelines seemed to sometimes change multiple times, even in a single day. From that screening and triage, in order to make sure we're not only being able to respond to questions, but doing a safe job of triaging, really trying to ameliorate some of that fear and yet get people who really were deserving of testing in line for it to move through. This screening function then, as you see, resulted in 3 outcomes. For many, it was, we think you're fine, let's just keep an eye on things. For others, it was a referral for treatment, in some cases, emergency treatment. And then finally being referred to testing. Now, one of the primary important elements here is to understand that during this time, during the screening event, we went through a registration process with the callers. And that really set the stage for a closed loop process. Next slide. So as we move on to testing, as I mentioned, we had done that registration of patients that were screened that we were going to refer to testing or to remotely monitor. And in fact, that allowed for the auto enrollment of these patients on a getwell monitoring loop. So they were enrolled. We'll talk later about the uptick, which we were very pleased with. This allowed a great limitation of exposure through all the screening. You know, there are a lot of people that were symptomatic that really, based on guidelines, didn't need to be tested. And so it was fantastic to have a way, even a digital way, to keep all parties safe, but to keep those touch points in play should their symptoms escalate, etc. As you'll see here, many of the patients were remotely monitored by a centralized clinical call staff of nurses, and actually some mid-level providers were involved in that as well. But many were actually directed then to go through to 3 different testing sites that we set up in the Maryland area, trying to conserve PPE, probably similar to you. That was a bit of a scary shortage early on, as well as the frequency of testing. We really needed to make sure in the early days that those few test kits that we had counted. Again, this also allowed a lot of visibility. For those of you that are using Getwell Loop, you know that when enrollments occur, you immediately have visibility into the digital journey of those participants. Next slide. So of the about 12,000 that were actually referred to the COVID test, and in this case, I'm talking about the nasopharyngeal swabbing, some of them did result in video visits, either to determine a treatment need. You know, our mid-levels felt maybe that the nurse was recommending an eyes-on before the screening, in lieu of just being directed actually to a care site, or in fact, post-testing. So during the post-testing process, after you got your test done through the drive-through, and again, I suspect many of you very quickly stood up similar operations to meet the needs of your community. This resulted for us in that requirement that was put upon us to give the patients their results back. So for us, this was about 8,000 phone calls that needed to be made by mid-level clinicians. We chose to do many of them in person and telephonically. Certainly, as you'll see, the majority of them did enroll in our loop. One of the things that was invaluable in using Getwell Loop for this purpose is that post-COVID testing, some of these symptomatic patients, in fact, did get much worse, and some very quickly, or merely just ended up with some concerning care situation where, in fact, they then had the ability through Loop to request a real-time video visit with our clinical team here. So again, another way to weave through different levels of care, certainly in an unusual time when most patients actually really didn't want to find themselves in a physician practice or in a hospital unless they needed to. Next slide, please. So certainly, not only did some of our screened patients become inpatients, but back to that essential element of organizational communication. If you weren't just being tested or remained on the outpatient side, Getwell as an inpatient platform afforded us the ability in a really nimble way to continually communicate with our inpatients about the guidelines, about reminders of infection prevention, hand hygiene, etc. And as importantly, and as many of you know, this was a scary time and remains to be so for many of our inpatients based upon visitor restriction policies. So Getwell Inpatient allowed us really to continue that communication in a very nimble, broad, and frequent way as the landscape was changing with regard to the pandemic. Next slide. And finally, follow-up. There was tremendous engagement with Loop. Yes, we did auto-enroll folks after the registration, but what we found, and we'll talk a little bit about it in the results, is that most people were very comfortable connecting in this way because they really had a vested interest in understanding either the result or their symptoms, and certainly it provided a different level of relationship, albeit one that perhaps was not as high touch as an in-person delivery. So the goal of this area was to monitor symptoms and progress until they fell off the loop, if you will, and then to provide follow-up education and support, which we were able to use and push through in a mobile way. Again, we did have some challenges in this space. Scale is always a problem, not as much for Health Loop as actually making sure we had sufficient staffing, 7x24 in our clinical call center. And then certainly we were all responding so quickly to the pandemic, it wasn't always as personalized as we would have liked it to have been. Next slide. As you can see, these really were the outcomes that mattered for us. Very proud of the team, actually, and believe me, we didn't get it right the first time, but our GetWell partnership, both from an organizational perspective as well as a product perspective, allowed us to iterate together during this very interesting time of dynamic change. And as you can see on the left-hand side, we had over 50% activation and over 9,000 patients physically enrolled. We really do believe that we reduced the hospitalization activity during this scary time for many. We were able to avoid unnecessary office visits or phone calls. We actually had over 4,500 specific comments that our mid-levels and nurses were able to digitally attend to in monitoring the loops that these patients were on. And in fact, we consistently received both comments and scores of satisfaction that were indicative that we were able to meet the mark and the needs of our community. All right, I think I'm done, Whitney, and I'll hand it over to you. I hope there's some good questions later.
Yeah, absolutely. If you could change the slide. Thank you so much, Tressa. For folks who are interested in a copy of this story, and we have kind of summarized it into a single page for you all, and there is going to be an opportunity to request this at the end of the call. So we're gonna transition now. If you could go one more slide forward. And we worked with organizations like LifeBridge, and we really discussed how do we apply a strategic go-forward strategy. So to discuss our key observations and strategic implications, as well as to introduce the GetWell Network go-forward strategy, which I know some of you are excited to see, I'm going to turn it over to Candace Chan.
Thank you, Whitney, and thanks, Tressa, so much for sharing your response to COVID today. It was certainly very impressive for us to see how quickly LifeBridge was able to mobilize and coordinate these programs. And I think it's, as you said, it's some of these digital tools, but more importantly, we, having worked with you guys so closely, know that you had already stood up a very strong infrastructure and foundation with centralized care management, centralized call centers that really were so important and ready to kind of pivot to these sorts of efforts. And we'll talk about that more broadly as we go through these observations. As Whitney mentioned, we really had this privilege front row seat with organizations like LifeBridge as they responded to COVID with some incredible speed and innovation, especially as it relates to digital and virtual health. However, because of the speed at which these solutions needed to be deployed, many organizations have told us that they now find themselves with a sort of digital and virtual health approach that feels almost duct taped together. And so a lot of our partners are looking forward to the future and asking the question, what does our go forward digital and virtual care strategy need to look like post-COVID? What opportunities created by COVID should we capitalize on and incorporate into the way that we deliver care going forward? And so that's what I plan to spend this next section on, sort of 5 key observations that many of our Cerner partners gleaned from their response to COVID, and how is that impacting their longer term strategy. So looking at observation number 1, I think many organizations like LifeBridge saw this overnight explosion in virtual health. But as we kind of look at comments post those interactions, at least from our perspective, we've heard from patients that the reaction has been fairly mixed. You know, on one hand, patients really loved the convenience. They felt it was a better use of everyone's time. And on the other hand, the interactions themselves felt more transactional. At least that's what we've been seeing in the comments. Oftentimes, not as much follow-up, leaving patients sort of confused about next steps. And I think this largely goes back to what I said before about sort of the duct taped approach. The fact that many organizations, because of the speed at which they needed to deploy virtual and digital health, simply were replacing physical interactions sort of one for one with virtual ones. So, for example, call centers didn't have bandwidth to manage the volume of inquiries, so chatbots were implemented. Clinicians couldn't see patients physically, and so they used virtual visits. But there wasn't really any time for organizations to think about how they should be stitching together the digital journey for patients, or sort of creating these digital handoffs, if you will, between settings of care. And so the result is that the virtual health journey to patients feels perhaps even more disjointed and fragmented than the physical one, and it leaves patients more likely to fall through the cracks, not get the recommended care that they need, or in fact, leaving your network and getting care with a competitor or a provider or another provider. Ultimately, what we're hearing from our client executives is they believe that there will be more, this will more likely end up being sort of a hybrid physical and virtual journey going forward. And so they're looking for to really consolidate technology partners, go from the noise of, you know, the 50 different vendors that are being used today to a really strong core handful, and that core group of technology partners are really needed to also help triage and navigate patients between these physical and virtual interactions, so that, again, they get the care that they need and they sort of remain in network. The next observation we heard is that we've really seen digital care management and remote patient monitoring become a lot more prevalent, and also becoming core tools for population health and care management programs. So during COVID, like LifeBridge and many other organizations who had already made investments in value-based care infrastructure, like centralized care management, digital engagement, remote patient monitoring, population health analytics. These organizations we saw really could more quickly and easily pivot to managing COVID. But even those who hadn't, I think the good news is that for organizations that hadn't laid that kind of infrastructure yet, they were also able to stand up centralized care management teams very quickly and effectively. And many of these organizations are now thinking, how do we apply these care management teams now to other populations? A lot of care management teams, I think, were also asked to use some of these digital tools simply because of the sheer scale of which patients needed their care during COVID. And so digital tools, like you heard about the getwell loop tool that automatically interacts with and monitors patients on behalf of the care management team and sort of surfaces the patients that need actual intervention. We also saw sort of an uptick in care management teams leveraging those tools.
Candace, I think that's a really important point, by the way, before you move on, because you know, everyone participating knows we got slammed, and the inpatient organization wasn't slammed, but people in the community reach out to their care providers. They were scared and they picked up the phone, etc. And the ability, when you are offering something digital, to manage by exception really maximizes and makes sure that those individuals that need that level of appropriate clinical care get it, as opposed to just throwing bodies at the problem. So I did want to comment on that, because it really allowed us to be much more effective with just the volume coming at us.
Yeah, absolutely. I'm glad you weighed in on that because, again, I think in the past when we've worked with organizations around their care management team, care management has been sort of very resource intensive, often nurse intensive, nurses sort of picking up the phone, and just by the limitation of resources, being able to really only impact the highest risk patients. But I think, again, with COVID, many more organizations were willing and needed to embrace sort of these digital tools, again, to be able to scale and manage vast populations of patients. And what we're seeing is that this sort of aha moment, if you will, for organizations in combining these sort of digital tools with their care management teams is causing some of the clients that we've talked to, at least, to think about, gosh, like, how do we now leverage this model to be even more successful under risk-based contracts, and maybe even extend the risk that we are taking on, because the ability to scale those care management resources allows them to become much more proactive and not just serve the highest of the highest risk, and actually get deeper into that population health triangle, going to the rising risk and being more, again, proactive with those individuals, which ultimately is what makes organizations successful in population health. The third observation that we saw was with the regulatory environment continuing to really favor digital and virtual health. CMS has already demonstrated sort of leniency in reimbursements in all 4 of the areas that you see on the page now, and many commercial payers have followed. We're also hearing indication that the physician fee schedule in 2021 will leave the doors open during COVID and post-COVID in these 4 areas, probably for the long haul, which is great news. And the implication of that for our clients is that, again, they're looking for technology solutions now that also really help to facilitate that data tracking and submission for reimbursement to capitalize on these dollars. At least from a loop perspective, what we're seeing clients get reimbursed for between $20 to $80 per patient for remote patient monitoring. And as sort of legislation evolves, our product team is, as you'll see later, adjusting our roadmap to include even more functionality to kind of support maximizing these virtual care reimbursements going forward. We've also spoken with organizations that have really been successful at taking some of the programs they have with existing payers and even approaching other payers that may not be today offering reimbursements in the virtual and RPM space, and actually being successful in seeing those payers come on board as well. So very exciting. The next observation is really about that many organizations expressed to us is that COVID has made many of them realize sort of the necessity for investment in consumer digital technology. When patient interactions become mostly virtual, as they did with COVID, that really shed a light on the fact that many organizations did not have the ability to drive and sustain digital interaction with their patients. You know, I think there is a realization that there's need to augment digital front doors and the portal and other tools that we have in place today. Those have house a lot of critical information for patients, but they, at least again today, tend to be more self-service oriented and patient directed. And that, I think, needs to be coupled with sort of an interactive push and pull nature of consumer technology that I think we've all come to expect in other industries, and that will be required in the future for providers not only to, you know, continuously drive engagement with their digital solutions, but ultimately the goal of these digital solutions is to motivate patients to take desired actions, to stay on their care plan, to self-manage, and that is what ultimately drives improved outcomes. Given our strategic partnership with Cerner, I'm really excited to talk about some of the developments that we have been working on together that we're actually releasing very shortly in the October and later this year timeframe, where we are embedding more and more of getwell's capability directly into Healthy Life, and that sort of increases the utilization of the portal and how we're designing it to really mutually reinforce both experiences for the patient.
Candace, I think your point, and I know the audience would agree, and I appreciate you suggesting that digital needs to complement an organization's other clinical elements. You know, everyone participating today knows it's about choice. And as you mentioned, when you really can get to the heart of the preferences of an individual, you're probably going to get a better compliance. And for those of us that have been in healthcare a really long time, a lot of our providers are frustrated because they tell these patients time and again what needs to happen to improve their care status, but they don't change. And so this recognition that really, unfortunately or fortunately, we're going to need to harness technology so that we're offering choice and various options to doing the same things in order to get a higher level of clinical compliance, I think is going to be a reality. And I appreciate you using the word complement, because it's not one or the other. For those of us in the trenches trying to get it done, the expectation is it's going to be all the above.
Yeah, absolutely. I think if you can harness the power of those two things together, that's where we see organizations really get that tremendous engagement and the results that they're looking for. Okay, last key observation was really around looking for new sort of business opportunities during what has been a very difficult financial environment for health systems. One particular area that I think we've seen present itself during COVID are more and more sort of these direct employer partnerships. It's not a new concept, but we have heard from many clients that there are more employers today that have been proactively approaching health systems for help in managing COVID for their employee populations, or in the Sequoia example here, even just providing consulting support on how to clean effectively and prevent infections in a way that meets CDC guidelines. I think what we're seeing here is that you know, some of our clients are looking at these opportunities as sort of a foot in the door with these employers, hoping to develop those relationships, which then will allow them to expand their services to things like on-site clinics, virtual care, chronic care management, wellness, and again, create sort of these new revenue streams for organizations. Well, so that brings me to the end of sort of the 5 key observations. Hopefully that was a helpful run through of the impact of COVID on digital health and the implication on future strategy that at least we've gleaned from our clients. Before I move on to the final section of the webinar, Tressa, you've been chiming in, but any other reactions or things you want to add about the implications maybe for LifeBridge's strategy?
No, well, I think I hearken back to what my peers have surfaced, which is this is a very dynamic time, and we shouldn't expect that it's going to get any different or be any different in the future. Whether right, wrong, or indifferent, sometimes our ability to nimbly lean into these solutions has created a different expectation about our ability to do so and do so quickly. And so I think we're going to just see an iteration and an ability to add small tests of change on a continual basis. And that's where more flexible tools and capabilities are really going to make the difference.
Yeah, thanks, Tressa. I think that's a well-made point about the change management aspect. A lot of the other CIOs that at least I've chatted to, I think we've seen as an industry that change can happen quickly and effectively. And as you said, it's an opportunity to kind of harness that kind of going forward. Okay, so with that, thank you, Tressa, again. In the final section of this presentation, I wanted to spend some time talking a little bit about how Getwell Network is responding to these sort of market needs and sort of the implications we just talked about. 2 pieces in particular that I wanted to spend time on. First is a sneak peek at our new cross-continuum platform and mobile app that we really designed to help navigate patients through that hybrid care environment that we talked about earlier. And then second, as I said, really exciting developments with respect to smart apps and other integrations that we've been working hard at directly with Cerner that we're releasing later this month, both for clinicians and patients to more directly access the GetWell Network tools within Millennium and Healthy Life. So just jumping in, for those of you who may not be familiar with GetWell Network, we have been providing patient engagement solutions for about 20 years. And we have a suite of both inpatient and ambulatory solutions that can help patients, as we said, navigate, that guides patients through sort of their episode of care. And in response to the need for, as we said, solutions that can help patients through this hybrid care environment and really help triage patients between, is this a physical encounter, is this a virtual encounter, and how do we stitch that together with all of the right handoffs to create a seamless experience for patients. In service of that, we actually have been working on and have accelerated our work to combine our solutions into a single platform that provides a unified digital experience for patients across the entire continuum, provides sort of personalized step-by-step guidance, and really feels like the care team is with the patient every step of the way on your behalf. And we feel like these curated experiences are what keeps patients and families sort of in the loop and ultimately coming back to you for their care. And so we're excited to announce that in February of 2021, just a few short months from now, we will be releasing the first version of our platform that combines these capabilities. And LifeBridge, we're so grateful, is actually one of our partners, close partners, that is testing it for us right now. The platform that we call GetWell Anywhere will be a device setting and device agnostic platform, meaning that it will be applicable whether they're at home, in the clinic, in the hospital, and it can be displayed on a smart TV, on an enterprise iPad, or on the patient and family's own mobile device. And by sort of putting these all together across the continuum, we're really able to provide organizations with this longitudinal view of the patient that helps them to improve coordination and sort of facilitate handoffs between the different settings of care. In addition to the GetWell Anywhere platform, we'll also be launching in February the GetWell Anywhere mobile app for patients and families. And as I said, this is sort of the app that in this first phase will combine our GetWell Loop product and our GetWell Inpatient product into one end-to-end experience for patients, and over time become a much more integrated and seamless experience. But why don't I actually show you what that looks like? So bear with me while I just switch screens. Okay, hopefully I did that right and people can see the phone at this point. But just to kind of orient you, we're looking at an example of Catherine, who is a patient going through a total knee replacement. And with the GetWell Anywhere mobile app, we're able to connect with Catherine as soon as that procedure has been scheduled and start to actually check in with her in preparation for that procedure in a few weeks. And as you can see, from Catherine's perspective, this is coming from her surgeon, from her physician's office, and feels like, you know, her physician is sort of checking in with her and helping her with that preparation. So why don't we just step into that, and I'm just going to show you a couple of different screens, not the whole experience, but really allowing us to automatically check in with patients on your provider's behalf, and again, surface anything concerning to your teams when needed. But here we're checking in with Catherine several days before, letting them, informing her to let us know if she's sick before a procedure, if there's any fever or coughing or wheezing. She doesn't have any of those symptoms, so we'll continue the check-in around giving her instructions about arriving for the procedure tomorrow with an empty stomach, remembering to stop eating right before midnight, again, really providing this sort of just-in-time information as she gets closer and closer to the procedure. And then also allowing her to indicate if there is anything that, again, might be concerning before the procedure. In this case, looking for any rashes or scratches or bruises that are near the area where the procedure will be done. And if there is something concerning, she can let her care team know and upload a photo so that they can intervene if needed. But in this case, there's no issues, and so we can move forward. And there, if any questions she has, she can indicate that as well. So those are just some examples of how we can virtually check in with Catherine while she's at home prior to a procedure. Now we've switched gears, and you can see we're going from the My Loop tab to the My State tab here, because now Catherine has actually arrived at the hospital for her procedure. During the registration process, we have a couple different ways that we can do this, but basically allow us to connect her account to the fact that she's now arrived at the inpatient facility. So we can kind of check her in, if you will, and register her within this experience while she's in the hospital. And that actually gives her access to a variety of communication and services while she's actually at your facility. So we'll continue to check in with Catherine, this time from her inpatient care team, and guide her through education or steps that we need her to take. One of those being, again, continuing her education. So similar as how we were stepping her through the pre-procedure education, we can do the same while she's in the hospital itself. We can actually ping her with additional education that we might like her to view while she's in the facility, and that could be related to her procedure, but it could also be related to falls risk or other quality and safety initiatives that you have within the hospital. She can see which education she might have seen before, whether it was at home or in the hospital, and continue that journey of viewing the education, indicating whether that education was viewed by herself alone or with a caregiver, seeing that education, indicating if she understands, and if not, again, we can flag inpatient care team to the fact that she may or may not be understanding her education, and then helping her get to other services that she might need while in the facility, like requesting a blanket if she needs additional help for certain things, so on and so forth. The other things that you can see on this home screen of the sort of the inpatient experience that is a little bit different is while you're in the facility, you can order your meals, you can fill a prescription if you have a meds to beds program, you can cheer on your nurse, you can watch a relaxation video, just as an example. You can also see what's planned for your day. So things like the, sort of a digital whiteboard capability, who are your caregivers, what does your schedule look like, and things that you want to note for yourself to interact with your care team regarding. And then again, now we've switched back to the My Loop tab here, but as Catherine is going home, we'll continue to check in with her post-procedure to make sure that she has everything that she needs from a recovery standpoint, and again, that we're collecting information for your care teams to help them intervene if needed. Here we are just asking if she's feeling uncomfortable and if she's been able to get up and move around to prevent blood clots. We've asking her to rate her pain and keep tabs on her temperature to make sure that we understand if there's any infections going on. And then, the other things that we can do are share with her additional information about all the activity that she might have had. So this includes education that she might have been prescribed in the hospital as well. If she wants to access that, that will be all sort of readily available for her, as well as other kind of checklists and resources. The last thing that we want to make sure that we're continuing to follow her all across the journey, but certainly towards the end as well, is just to make sure that we can gather their feedback. As you saw from Tressa and the outcomes at LifeBridge, we were able to track the satisfaction and questions and comments from the COVID community and many others that we kind of serve in this space. And it's important, again, to understand whether these sorts of tools and the experience overall has been helpful. for patients. So patients can kind of indicate that. And they can also be, if they had a positive experience, we can also kind of push them out to share that experience on a rating site, which has been really helpful. And we've seen some organizations actually increase an entire star as far as their Google and other external ratings as being part of these types of programs. So really capturing and capitalizing, if you will, on the great experience that your physical teams are doing, coupled with sort of the digital experience that's guiding them across the journey, and making sure that other patients and families are aware of that. And as we said, helping patients to really stay on track of their care plan, get the care that they're needed, and ultimately return to you for additional care. Okay, so that was just a quick look at the Get Well Anywhere app. Hopefully I have gone back to my screen now where I'll kind of finish up the rest of the presentation. Again, this is a snapshot of what I just showed you, and we're really excited because from a patient's perspective, as you can see, it's really one app that carries them through from the home and clinic experience, pre-surgery, into the hospital and all the amenities that they might need there, as well as following them home and giving your team sort of the visibility into that. With the last few minutes that I have, I wanted to kind of share just a little bit about some of the other product roadmap themes that we have that we're focusing on in addition to this cross-continuum Get Well Anywhere experience that I just called out. And again, our response to COVID. One of the things that we're really excited about is the addition of the care circle into this experience. So everything that you just saw for the patient, we are actively across 2021 adding an experience for the patient's family to be able to digitally understand the journey of their loved ones, view similar education, receive resources that are helpful for them to supporting the patient and their in their journey, because the patient, as we know, is often the sickest person in the equation, and so empowering their support network to help them again stay on their care plan and get the best outcomes possible, we think is going to have tremendous results. And this year we're actually going to be launching the first of our Care Circle care plans. So we've got about 180 digital care plans in our library, and we're starting to convert some of those to care plans that are targeted specifically to the Care Circle, again, so that they can follow along with that education journey. And over time, that's going to become interactive, where they can submit questions to the care team, answer questions on behalf of the patient, even do things like ordering meals for patients, so on and so forth. We're also embedding virtual health into our platform. So as we talked about, reimbursement is really favoring this space. The patient journey is becoming this hybrid physical and virtual journey, and we want to support as much of that as possible. So we are at the end of this year and early next year introducing on-demand video visit capability in our mobile app, in our mobile device-enabled capabilities, as well as our smart TV capabilities, so that virtual rounding can occur, so that patients and families can also participate in those interactions. I'll hold on integrated EHR experiences because I have a couple of actual screenshots I want to take you through the new Cerner experience. And then lastly, smart loops and insights and self-service tooling, just continuing to push the envelope on the being dynamic and personalized in what we deliver to patients, expanding our ability to serve new populations like pediatrics, behavioral health, and then giving our clients sort of the data that they need to really engage their patients sort of in a differentiated way. Last but not least, I wanted to share with you what we've been up to in the Cerner community in particular. We've really taken a three-pronged approach with Cerner and GetWell as far as like creating this sort of integrated experience. First step that we'll talk about today is really starting to embed the GetWell network tools into the clinician and patient experience, so that you don't have to leave Millennium or Healthy Life, and that all of that capability is sort of in one place and can be accessed seamlessly from a workflow perspective. The second is actually integrating our data into the native Cerner tools. So, you know, early next year, things we'll be working on are putting our alerts directly into Message Center as an example, so that again we are really facilitating that seamless workflow. And then the final stage would be to leverage the combined data to drive smarter interactions. So in the future, we really feel like by looking at Cerner's data and getwell's data, we can start to make recommendations to providers potentially for education or things. So patients like yours viewed this education, or or took this step, and we can start to actually make those recommendations going forward. As far as what's available now and very shortly, actually should be hitting the sort of smart app portal in the October timeframe, is first we actually took the getwell loop capability and created a clinician smart app, which I'll show you in a minute, for the getwell loop experience, and then also created a clinician smart app for delivering patient education in the inpatient environment. And then also created very seamless access for the patient within the Healthy Life consumer framework. This is a view, an actual screenshot of the clinician smart app, and as you can see, there's a couple different ways you can get to it, but this is really the only digital care management platform today that can be prescribed sort of natively, but within your patient's chart in Cerner. So if you're within a patient chart and you click on sort of the getwell loop tab, you actually can pull up information on that patient from getwell loop directly within the chart. You can also go to a dashboard view if you want to see sort of all of your patients. But again, this prevents you from having to toggle between different applications. It's just sort of embedded seamlessly into your workflow. On the inpatient side, we're also allowing clinicians to click on the getwell inpatient tab within a patient's chart, and they can actually start to assign education to that patient that may not have already been auto assigned to them. So while they're reviewing the chart, they can launch those pieces of education, which will show up on their getwell inpatient solution, whether that's on the TV or mobile, and they can also track the progress against that education or any other feedback through, again, directly from some of the Cerner workflow. And then finally, on the patient side, we've really integrated it within Cerner's consumer framework. So not just only a tab, which you can access here, but that sort of dashboard view of Healthy Life. If there is a check-in that the patient needs to look at, that's going to pop up directly on their Healthy Life dashboard, so they can kind of check in now. And we're also sort of, again, reinforcing the sort of portal experience. So if patients are within getwell loop and they haven't activated their portal, we will sort of direct them to do so, and vice versa, as you can see here. And so I think we're building in a very dynamic experience within the portal, which we believe will increase also sort of utilization of both of those tools, but really feel like a single entry point for patients. Well, that was all I had prepared today. I know that I went a little bit longer. Sorry about that, Whitney. Hopefully we still have time for a couple of questions.
Absolutely. So in the last 6 minutes, we did get a couple questions that came in throughout the presentation. So the first question here is, we don't have centralized care management. How would Loop work for an organization like us, or is having a centralized system a requirement? And Candace, if you want to take that, I'm also happy to answer that question.
Yeah, go ahead, and also would love sort of Tressa's thoughts as well. So yeah, please.
Yeah, so what I would say is that Loop is really designed to work within your current infrastructure or workflow. So we have a team on our end that actually partners with organizations during implementation to understand your workflow, the resources available, and really match the configuration to you. So you do not need to be centralized already. For the COVID work that we did, we actually, I think, over 30 different workflows that we implemented just for the COVID work. And so we'd be happy to walk through those in detail during a follow-up call if that's something that would be helpful. Tressa, is there anything that you would kind of add to that around folks responding?
I would, because although my examples today were in a centralized model, we actually in our organization have both. In fact, we have hybrid, where there's some steps that are centrally monitored and some not. And then we have use cases where some of our loops are completely decentrally monitored, like our orthopedic loop, which is chosen to be monitored very specifically by some navigators that are part of our Rubin Institute. So I guess the point is it can be an organizational efficiency or asset, but the tool itself does not require that.
Great. Another question we got is, what barriers did you encounter with seniors or tech-savvy individuals, or how do you address tech with patients from an education standpoint?
Tressa, I'd love your thoughts on that.
Actually, some of it's statistical, but most of it is actually experiential. Especially during COVID, as we know, older individuals were in an at-risk category. And when we looked at the findings, we actually found that the older generations were just as apt, if not more, to use digital means. And maybe in this case, it's because they understood there was an additional risk and this helped them mitigate that. But we've been, just in general, very surprised at the uptick above the age of 70. We actually had some initial assumptions that were very similar, and yet we found many of them not to be the case. Plus, although when we think digital, we all think of smartphone enabled, there certainly is the web enabled capabilities too, for those that aren't necessarily as smartphone capable. So I think the punchline here is we've been surprised at the uptake in compliance and utilization by older individuals.
Yeah, I think we would echo that as well as far as the broader experience from the getwell cohort. The second thing I would say is that's one of the reasons we're also introducing the care circle, because we really feel like whether they're older or younger or tech savvy or not, there are moments in time when patients are just really sick and they're just not able to engage on their behalf. So introducing a family member into the loop, as an example, giving them visibility and later interactive capabilities, if they're authorized by that patient, will really allow them to support the patient from anywhere. They don't even have to be living in the same city, but be able to be an extended part of the care team to help that patient, again, understand their medications or take the right steps before a procedure, or even order things while they're in the hospital facility as well.
Great, thank you. I think we have time for one more question. And if your question did not get answered, we can follow up with you. So the last question here is, Candace, probably a functionality question for you. The question is, does the portal link allow for discharge instructions to be recorded for the patient to review later when they get home?
So I'm not the expert in this space, but my understanding is that will be available through, that's something that's available through Healthy Life. So again, for those who are using Loop, now that it is fully embedded within the Healthy Life portal and framework, a patient would be able to kind of access those capabilities sort of all in one place.
Perfect. So with a minute left, I did just want to thank our speakers and everyone for joining. We have a next step slide pulled up. So there is a survey that will pop up once you close out. We hope that you'll answer. In that you can request the slides and the case study, that way we can send those out, as well as the recording. Current clients are going to receive information from their client services manager regarding the new integration options, so you can get deeper there if you're interested. And then if you are interested in kind of a deeper dive on your go forward strategy, or interested in, we are actually offering complimentary executive digital health strategy sessions with our CEO. If that's something that you'd like to learn more about, please let us know that as well. We've included an email address here that you can send, or let us know in the survey. Thanks everyone so much for the time today. We appreciate you joining.
Thank you, Candace and Whitney.
Thank you, Tressa. Appreciate it.